My name is Dr. Abhinav Srivastava and I am spine surgeon. Disc prolapse. Disc prolapse is a very common problem. So let's discuss about this. What is disc? Disc is a cushion-like structure found between the two vertebral body. Now, if we cut the disc horizontally, we will find two things: the outer tough layer, multi-layered tough layer called as the annulus fibrosus, and the inner gel-like structure called as nucleus pulposus. What is the function of the disc? Disc makes our spine flexible. Basically, all the movements occurring on our spine are occurring at the level of disc. As the shocker of the bike transmit the load of the bike as well as protect the bike from any shock. Similarly, disc transmit the load of our body as well as protect the spinal vertebra from any shock. Now, what is disc prolapse? If there is a rent in this outer tough layer, the inner gel-like structure protrudes out from this rent, leading to disc prolapse, which may compress nerve, causing pain or weakness. It can occur anywhere in the cervical spine, in the upper back, or in the lower back. Now, if we cut the spine horizontally, if the disc prolapse occurs in the central of the spine, it is called as the central type. If it occurs laterally, it is called as a lateral or paracentral type. In the cervical spine, this central type of disc prolapse compress the spinal cord, and this lateral type compress only a single nerve root. In case of central cervical disc prolapse, person may experience weakness, tingling or numbness in the upper and lower limbs because there may be difficulty in walking because of the imbalance or because of the weakness. There is difficulty in hand functions such as buttoning of the shirt, objects may fall from the hand, there is difficulty in handwriting, change in the handwriting, and there may also be difficulty in eating food. Some person may experience vertigo or giddiness, and there may be urinary complaints such as stress incontinence, that is urine may leak out when a person cough or sneezes, urinary urgency, etc. Now, if the disc is of paracentral type, there is compression of a single nerve root which may cause pain, tingling of numbness along that single nerve, or there may be weakness of a single group of muscle only. In the lumbar spine, disc prolapse causes sciatica. What is sciatica? Sciatica is basically the involvement of the sciatic nerve. Sciatic nerve arises from the lower back, runs from the posterior aspect of thigh into the leg. Any pain along this nerve is called as sciatica. There may be sciatic list, that is, a person may lean to one side because of the spasm of the back muscles. There may also be urinary symptom if the nerve going to bladder are involved. Investigation of choice is MRI because we can see both the disc and the status of nerve or spinal cord with the help of MRI, whereas X-ray only shows us bone. What is the treatment? Most of the time it's medical, that is with the help of neurotropics and general lifestyle changes by doing exercises and walking. Now, there is a myth of prolonged bed rest. Bed rest should be as short as possible for 2 to 3 days because prolonged bed rest delays recovery. Person should be on his feet as early as possible if the pain permits. If the pain is not relieved with medication, spinal injections can be given, which are known as transforaminal injections or selective nerve root block. If the pain is in the limbs, lower limbs, the injection is given in lumbar spine, and if the pain is in the upper limb, the injection is given in the cervical spine. Less than 5% of the cases require surgery. Nowadays, most of the surgery can be done endoscopically with the help of an endoscope, which is also known as keyhole surgery or sutureless surgery, because the incision size is only 5 mm or 6 mm, and the patient can be discharged on the same day. Another minimally invasive modality is the tubular discectomy, which is done with the help of microscope or loop. In this, the incision size is also less than an inch and the recovery is really fast. And the third one is the conventional open surgery, in which 2 to 3 inches of incision is required. So surgery is only required in 5% of the cases.